The effects of regenerative restoration are not only achieved in the phase of research or experiments, but in the clinical application worldwide. Nowadays, more than 20 countries introduced this technology. More than 40 million patients were treated by our technology. Skin with an extensive burn wound can be regenerated without scarring or disability, especially some. Let's take a look at. It looks really ugly, like a wounded skull with soft tissue and a bone defect. Look at the wound with a bone defect on the skull. How severe is it? The wound reached the endocranium as seen under an X-ray. The cerebrospinal fluid is just under the endocranium. Nevertheless, regenerative restoration can also be achieved on such severe wounds. The skull heals gradually under the effects of MEBT-MEBO. Though it has not healed completely, it will be very soon. If wounds like this can be regeneratively restored, then the scars or fibrosis inside the body is not a problem anymore. It is unnecessary to worry about your skin, especially for women, since it can be restored to a younger status. This is not cell rejuvenation, but turning your tissue back to normal, which is regenerative restoration. What is more shocking, multi-organs are able to regeneratively restore simultaneously. Take a severed finger as an example. Regeneration of a severed finger does not only include the skin, but also the many other organs and tissues that must grow simultaneously in order to maintain the integrity of the finger. Whether there is a concept of simultaneous growth in human body or not, it's what I want to explain today. The organs in the human body, under the command of the brain, can coordinate with each other and regenerate in situ, which is even superior to the lower animals. We should be excited about this. For example, a lizard will regenerate its tail if it is cut off, since there is a germinative layer in the tail, but this will not occur in lizard's claw. However, human beings can regenerate their limbs, which demonstrate the superiority of higher mammals. Okay, now, let's take a look at the regenerative of a severed finger. The finger palatum is one of the major human organs rich in nerves connected to the brain, and we have different sensations when touching with our hands, which is different from other skin areas, since the finger palatum can discern many things. Well, let's see how this finger regenerated. The severed finger, like this, grew step by step, but it will be shorter than its normal length because bone grows slower than skin tissues. It takes about 50 days to recover skin tissue, while it takes about 3 months for bone to recover. About 2 years later, it can recover to its normal physical appearance and function. In the case of a severed finger, the fingerprint can recover its normal pattern. In this case, the finger of the patient was bitten off and he resorted to taking the case to court. But defendant said his finger hadn't been bitten up. You see, the finger was severed, but it was regenerated by our treatment. The defendant actually committed crime in this case, but he had no idea that the regeneration occurred. This is called one-time direct healing. It is better for the common people to know little about medical treatments, as long as they know to smear the ointment in time to regenerate a severed finger. Once some deburrment and disinfection are performed, the regenerative treatment efficiency of the ointment will be affected. See, this finger is broken from the nail base. It was replanted after injury and necrotized 6 days later. The wound was infected after necrosis. 11 days after we cleaned up the infectious area, the wound continued to recover. Yes, 11 days of regeneration, you see. The growth is very fast. At 22 days it healed. Though it healed, it was still defected because it was not as long as before. This is called incomplete regeneration. Why? This occurred because the wound was infected and the tissue did not grow synchronously due to the infection. What should we do? We must believe that our newborn finger body also has the regenerative potential. So, we innovatively tried to cut off the new finger body again to initiate secondary regeneration and promote its growth. This is the first time we tried it and we were successful. The defected part can grow and the bone can grow gradually. This case tells us that their human fingers include all the tissues of the human body, such as the 4 tissues, epithelium, nerve, muscles, and connective tissue. They can grow simultaneously, and all other organs in our body can also do so.